So, hey, everybody, afternoon. It's great to see you. I'm Carrie Chapman. I work for a legal aid organization called the Legal Council for Health Justice, and I use she, her pronouns. And we're a small legal aid organization that provides direct services and also does policy and impact work on Medicaid. And I'm here with two of my greatest collaborators and Medicaid champions, Stephanie Altman and Nadeen Israel. And I'm going to turn it over to Stephanie to introduce herself.
Thanks, Carrie. I'm Stephanie Altman. I'm the director of the Healthcare Justice Team at the Shriver Center on Poverty Law. I have worked in the field of Medicaid and insurance for many years. We work to train advocates around the state on how to enroll their clients and patients into healthcare options, and very happy to talk about some of those stories here today. Thanks.
Nadeen.
Thanks, Carrie. Hey, everybody. Nadeen Israel. I use she, her pronouns. I am the Senior Vice President of Policy and Advocacy at AIDS Foundation Chicago. We exist at AFC in order to end the HIV epidemic in Illinois by 2030. And we are also working to end homelessness through our affiliate organization, the Center for Housing and Health. I have been doing Medicaid advocacy for a number of years as well in Illinois with these two folks. So for HIV specifically, roughly 40-ish% of people living with HIV are on Medicaid. So it's a large population that is insured and gets their healthcare services through Medicaid, which is why we pay so much attention to a lot of advocacy work.
We also answer questions every day, and those questions increasingly are on unwinding and redetermination issues. On Help Hub, which is a technical assistance center for enrollment assisters we run. It now has over 3,900 members. We have experts on there like Carrie and Nadeen, and many of these individual issues and stories that we hear, we raise as systemic issues if they're barriers to our Medicaid agency. These kinds of individual cases and stories, and we certainly try to help the individuals as well, but these stories really give us credibility with these state agencies because they know we're on the ground helping those recipients. One recent success story is we trained the call center staff at Chicago Metro 211, a hotline, for the first time. We'd never trained them before. And we gave them information about the new Medicaid redeterminations or the public health unwinding. And they actually called us back 2 weeks later and said that an elderly woman who'd been on Medicaid for years called them very upset. She didn't know who to turn to because she showed up at her pharmacy and they told her that she couldn't pick up her prescription because her Medicaid had been terminated. It turned out that was due to not completing a redetermination. She never got the form. But because of the training and the outreach we do, this call center staff knew what to do. They advised her on how to request a reinstatement. And actually, she was reinstated very quickly, and she called them back to thank them and to let them know, and they told us. And that was just an exciting way for us to see live what it means for us to not just gather these stories and do outreach and train people, but that we really helped somebody and that they called back to let us know.
That is always great to get that feedback loop, and certainly does not always happen. So Nadeen, tell us more about what's working in Illinois.
Sure thing. So I would say another thing that's working well is the ex parte process. So this is the process essentially where with the renewals, with the Medicaid renewals, the state Medicaid agency pings the data systems that exist that it has a relationship with in order to verify eligibility and renew somebody without the person having really to do anything. The idea behind this is that the state has a lot of access to a lot of data already electronically, and so that they should do everything they can in order to make sure that they minimize the burden on the person who's on Medicaid. So we part of the reason why we think that it's going well in Illinois is because of we had actually, as advocates, this group and lots of other folks outside of this group in Illinois have been doing advocacy on the ex parte issue with Medicaid redeterminations pretty assertively since at least 2019. with the idea that we knew that there was more opportunity there. So we had tried at that time legislation at the state level, and we'd done a lot of negotiation conversation with the state Medicaid agency to help them see that there are groups of people where this is very possible to do. So because of that, we believe that the state was more ready when it came time to picking up the unwinding process again more recently, and specifically with folks who are come back as zero income. So folks who aren't showing any income or are showing zero income, that those folks can actually be ex parte, so automatically renewed, as long as, of course, they are eligible with the other checks as well. So that's been a huge help. I think we're at like, we only have a month or two worth of data, but we're sitting at like 51%, I believe, for Illinois ex parte. And traditionally, because we had this data for previous years, we would hover between, say, 25 to 35% for ex parte. So we were able to jump up quite a bit with adding that zero income population. So I would say that's a huge win. There's more opportunity though to do better. So I will hold off on that when we get to that part.
All right, we have to save some powder for challenges. So I think one of the things that's working well in Illinois, and Stephanie sort of alluded to this at the beginning, is that we really have an all hands on deck strategy. And I think we've done a really good job as a state of enlisting everybody to help in the process. And one of the key players in the Chicagoland area is the Chicago Public Schools. So they have long had a benefits enrollment unit because so many kids who are in the Chicago public school system are eligible for benefits. And so making sure that families can get into Medicaid and SNAP and TANF. But they have made a particular effort on Medicaid redetermination. So doing a ton of communications with students and families. And beyond that, standing up a call line so that folks who have questions about the redetermination process, either they don't understand what's happening, they don't understand their notice, they don't know what to do next, they've been cut off. They can actually call the call line and get information about what to do next. And, we have in Chicago public schools somewhere in the ballpark of 300,000 students. So that's touching a lot of families. And they have sophistication in benefits programs because this existed pre-pandemic. They're really able to understand the details of the program and to help people do the redetermination process. And so I would say, one lesson from us is think outside the box about who can be helpers and messengers on this, who's trusted, who touches community regularly, and who has some natural experience with benefits programs, because they are complicated and giving advice and support to people is really difficult. So I think that wraps it up for an Illinois update. All three of us are always available to take questions for folks if folks want to know what's happening in Illinois, what things we've done well, and whether they might be workable in your state, or how we're dealing with challenges. If the challenges are similar, then you're welcome to reach out to us. And help will have our contact information. And it was great to talk to everybody. And I'll see you guys on the flip side soon enough. Bye-bye.
Bye, everyone.